Hi, my name's Emily Savage, and I'm a master's in public policy candidate at Harvard Kennedy School. By the time you see this, I most likely will have graduated in May of 2021. I grew up in the Washington, D.C. area, and I'm interested in healthcare policy and healthcare delivery in the US. For my master's in public policy research project, I had the distinct pleasure of working with Intermountain Healthcare, the Salt Lake City, Utah-based non-for-profit integrated health system that serves almost 2 million patients a year. The central question that we asked was, how can Intermountain and its population health arm, Castell, better identify health disparities and health inequities in its patient populations? I answered this question in two ways. First, qualitatively, by interviewing more than 15 leaders at 9 different health systems around the country, from Kaiser to the Mayo Clinic to Massachusetts General Hospital. Second, I answered this question quantitatively, by spending many hours in Python analyzing 4 patient data sets on preventative health services, whether or not patients received cancer screenings and pediatric vaccinations. The results of my findings showed that a wide range of factors influence whether or not patients receive these services, from where a patient lives in Utah to the socioeconomic status of their census block, to the language that they speak, to the type of provider that they see when they go in for a visit. I tied my recommendations for Intermountain to these analytical findings, suggesting things like using the pediatric clinical pathway in family medicine visits to increase pediatric vaccinations and ensuring that Medicare patients received enough outreach to know when they were eligible for colon and breast cancer screenings.